Good morning to my friends in UK, Europe, Germany, Austria. Good afternoon to those friends of mine in Eurasia, South Africa, Egypt, and good evening to those of us in Asia, all the way down to Indonesia. Uh, it is indeed my pleasure to be your host for this series of webinars. My international group of friends and colleagues would like to share our experience in HIFU with you. Then what is HIFU? HIFU is high intensity focused ultrasound, a procedure that will change the practice of gynecology and would add a new dimension to treatment of uterine fibroids and adenomyosis. We are talking about a knife, a virtual knife. In fact, the knife is invisible and you can't hear the sound because the sound will be emitted just above this triangular bowl of water and will probably hit somewhere here. So this is the virtual knife known as HIFU. This is brought to you by my two organizing societies, APAGE and ISMIVS. APAGE stands for Asia Pacific Association of Gynecologic Endoscopy, founded in 2003 in Taipei. I will try to identify all these friends of mine. This is Professor Li Qilong, the chairman of APAGE. This is a friend, I think his name is Bruce. This needs no introduction. Professor Harry Rich, the man who did the first laparoscopic hysterectomy. My friends behind, from Japan, Whye, from Korea, Nam, myself, Professor Yuan Pangmo, and this young fella is, believe it or not, is our speaker and the president-elect of APAGE, and you see him very soon. And one more, and that is one of the fastest hands and fastest fingers with the electric guitar is Professor Masaki Endao, standing behind. This is a recent picture with of us taken in Chongqing in 2019 July. You can see most of the hair has turned brown or white. That is Dr. Jay Cheng from Taipei. Hugo, our friend from Germany, Europe. Doing yoga is Professor Salva from Malaysia, Malacca. Myself, and this one is well-known figure in China, Hong Kong, Professor Felix Wong, and of course, the chairman of APAGE and whom everybody knows, Professor Li Qilong. This is ISMIVS. And ISMIVS, founded on the philosophy of diseases that harm require therapies that harm less. That is their ideology. And they have biannual meetings. They call it Yangtze Summit, held in Chongqing every 2 years. Founded in 2013. This is a picture of the crowd. When you have anything that is held in Chongqing or in China is in the thousands. This is 2015, and this is 2017, where I first met friends from ISMIVS. The old name is ISMIVS. Right behind is Anthony from Spain. That is Professor Felix Wong, our friend Virak from Thailand, Somchai from Thailand. And this is the recent page photograph again. This is the board member led by, at present, Professor David Cranston, I think this is Gail, and all the other members. This is Professor from South Africa, Professor from Egypt, and this is the very active Minister of Foreign Affairs, Rosie Singh. There's a Choi that will be the speaker later, and all my friends. And right here, my teacher, Zhang Lian, and this is Professor Okay. Hey, one of the things that captivates me is when Professor David Cranston spoke about HIFU last year, and a very interesting statement he made was HIFU therapy can activate anti-tumor immune responses. I think it is really something which I never expected. Something from sound can be anti-tumor. The next picture will be, then we have the closed door meeting in Chongqing. On the left-hand side, all the members from ISMIVS, and on the right-hand side from APAGE. And after the closed door meeting, the following day, we have signed a memorandum of understanding that covers HIFU training, education, research, and certification. On stage are the members from APAGE and ISMIVS, and behind is the chief of ONG in the whole of China, Professor Liang Jinghe. He represents the China ONG Association, and under him, an association with 160,000 members. That's Professor Liang Jinghe, witnessing the signing of the MOU. Now, it is my personal journey and also a journey for many of the gynecologists, and I think future gynecologists, whom I term is an evolution from laparotomy, open surgery to laparoscopy, and now to really, really scarless surgery. In other words, you really do not have a scar on the skin. Even the laparoscopy and however small the incisions are with your laparoscopy, there will be a scar, but this is truly scarless. The highlight of this is, I want to show everybody is, that there are actually two different versions of therapeutic HIFU for benign uterine tumors. First, we have the MRI guided, which actually give you a thermal power, versus what we are talking for the next 4 webinars is ultrasound guided HIFU. And ultrasound guided HIFU has ablative power in contrast to thermal power. There lies the difference. And I have a little summary here, but I think the speakers will delve more in detail. And that is, if you compare MRI guided HIFU and ultrasound guided HIFU, the treatment efficiency, called MPV, is 20 to 50%, and it is about 80 and 90% if you use ultrasound guided HIFU. In other words, the ablative power, the efficiency is much stronger. And if you want to ablate or treat any fibroids or adenomyosis, you need something that's more than 70 to 75% of treatment efficiency, or NPV. Now, what's very interesting that made me walk back to listen to somebody who wants to talk to me about HIFU is, in MRI guided HIFU, it is the interventional radiologist that is doing the work, but in ultrasound guided HIFU, it is a gynecologist or any trained doctor. So because of the ablative power of the ultrasound guided HIFU, it is a procedure that can be done by gynecologists, surgeon, or radiologist, or any trained doctor. And the duration of ultrasound HIFU procedure is independent of the MRI machine. So the MRI machine or facility can be put to better use. In other words, we do not need to trouble our radiologist colleagues so much because they are busy people. Okay, there are 4 webinars organized by the 2 societies on uterine fibroid and adenomyosis. And there are 20 experts that will be joining us from all over Asia, Europe, and the world. And
page, no,
plus, one, I would say, mystery guest that will join us. And the dates are today on June. The next one will be on Tuesday, the 23rd of June, followed by 2 weeks later on the 9th of July on the Thursday. Last one on the Thursday on the 20th. Can I request that somebody mute the audience or the registrant who just joined us? Thank you very much. Okay, today we have my co-chairperson is Professor Zhang Lian. Professor Zhang Lian, my co-chair, is the Secretary General of ISMIVS. He's the professor of Chongqing Medical University. He is the man or the chief trainer that has under his arm 60 other trainers all over Asia, Europe, to train practitioners who wants to learn HIFU, and every trainer must have at least done 1,000 HIFUs in order to qualify as a trainer. That is Professor Zhang Lian, my teacher. There he is teaching me, and then he was giving a talk to us in Singapore. Then the next is panelist, Dr. Manjula. She is the head of department, chief OBGYN and laparoscopic surgeon, and she works out from MaxCure Soya Hospital, which is awarded the best emerging hospital in ONG by the Times Healthcare Achievers 2018. Dr. Manjula is the winner of many academic and clinical achievement awards. Notable, very notable, is she is the Guinness World Record title holder for removing the most fibroids in a single operation. All in all, she removed in a single operation 84 fibroids, and she's the record holder of the number of fibroids removed, and it is noted in the Guinness World Record. That is Dr. Manjula. Next. The opening remarks will be given by Professor Li Qilong. He's the chairman of APAGE, founder of APAGE, pillar of strength of APAGE, a great teacher of laparoscopic surgery, especially in the very demanding field of laparoscopic cancer surgery. He teaches MIS to many countries in Asia, year in and year out, tirelessly. He's very well respected in Asia and the world, and he's based in Changkeng Memorial Hospital in Taipei. The next that will be doing the opening remarks is Professor David Cranston. Professor David Cranston is the president of ISMIVS, which is the International Society of Minimally Invasive and Virtual Surgery. He's a urological surgeon. His special interest is in renal surgery, and in 1986 received an award for kidney transplantation based on his research. In 2001, he was the clinical director of high-intensity focused ultrasound unit in Oxford, and together with a team from United Kingdom and Chongqing, China, they are researching into treatment of cancer without surgery. He was the first recipient of the Golden Cystoscope Award in 2001 and has performed more than 2,000 operations on the kidney. He played a major role in getting the recognition of HIFU for fibroid treatment into NICE guideline, and NICE stands for National Institute for Health and Care UK in the UK.